The subject of human immunodeficiency virus, HIV, is one most Nigerians approach with caution. And though there are adequate awareness amongst Nigerians, the general risk perception of HIV infection is a mixed bag. Hello and welcome to another episode of The Last Mile with NACA. I am Adesuwa Osui. HIV was first discovered in Nigeria in 1985, but several years after, and scientific milestones achievement in the prevention and treatment of the epidemic, which has helped in reducing the spread and deaths. Is HIV still a threat? You're watching The Last Mile with NACA. Don't go away.
I don't see it as stress because right now you can live with it, have your partner, your family live with you, and then everybody's fine. The society is changing, things are not the way it used to be. So I think it's just one of those things. It could be headache. People die because of headache. People don't know they have the high blood pressure. So I just see it as one of those other illnesses out there. So
actually, I don't go lie, they fear me. And they just say it get very way we say if you drink, the thing go gradually. But really, I don't really sure whether it's true or not. That is why they fear.
Well, I don't really have people around me with HIV, but I think with the retroviral drugs, it is not more a threat. As long as you can manage it, it is not more a threat.
Because it's a deadly disease that eventually it will lead to death. So nobody wants to contact such disease. Yeah, so surely it's a threat to our society.
4 decades after the first cases were reported, there is still no vaccine or cure for the human immunodeficiency virus, HIV. However, with increasing access to effective HIV prevention, diagnosis, treatment and care, HIV infection has become a manageable chronic health condition, enabling people living with HIV to live long and healthy lives.
HIV is a virus, as we all know, and it is a special form of virus that is called retrovirus. What it does is that it identifies some cells in the body that are very important in terms of fighting disease within the body and now attack these cells. It makes the individual vulnerable to diseases, and once those diseases start manifesting, that is the stage you call AIDS.
In the beginning, a lot of people were dying because we didn't even know what it is that was hitting us. There were a lot of insinuation. It is witchcraft, it is this person, it is that person. Nobody knew. Oh, it is this guy kind of people, it is this tall people, it is this skinny people. We didn't know. But as science was making stride, we were studying what is it, what can we do, how does it look like, what is the pattern. And then we came to understand the disease more. And we came to understand the kind of things that are like predisposes one, that increases the vulnerabilities. One, we discovered the rights issues, where rights are denied, where people are poor, where there is socioeconomic dislocations, where the health system is not strong enough, where people are uninformed properly, where the tools to protect oneself is not there. We realize that these are fertile grounds for the spread of this. Ignorance, the most important.
Though the mode of prevention, treatment and testing deployed in Nigeria isn't too different when compared to the rest of the world, there are still concerns on how to decrease new cases of HIV among certain populations, which also begs the question, is HIV still a threat?
Why should we continue to pay attention to this matter of HIV? The whole world, everybody seems to be fatigued and tired of hearing it. But HIV remains a threat, a serious threat to the survival of individuals and even the nation as itself. It is causing a lot of emotional, cultural schisms that people don't know about. HIV is affecting the youth, the most productive, the most vibrant, that should develop the economy and pay tax into the economy. Usually the youth don't fall sick, they don't consume. It is the elderly and the very young that government spends a lot of resources on for their health. But you can now imagine the youth that should be vibrant, working, that should not fall sick in a year, we now have to spend a lot of money because they are the ones most affected by HIV. The statistics we have right now, on an annual basis, about 86,000 Nigerians are getting newly infected. The saddest part of it is that of the 86,000 that is getting infected annually now, what we have realized is 22% of them are children that are just being born. A mother that is infected, that is not on drugs, that we don't know, transmitting it to an unborn child.
HIV is a threat, and it will continue to be a threat as long as individuals who carry the virus in their body are not aware they have the virus, or they are aware they have the virus, but they are not taking medication. But if everyone that has HIV today in Nigeria will know they have HIV and will take medication to check the virus, to make sure the virus disappear from their blood and it doesn't leave their body to affect other people, as well as it doesn't get the opportunity to destroy their body defense mechanism, then we begin to say HIV is no longer going to be a threat.
The issue of sustaining the gains made so far has become a challenge in light of dwindling resources.
We have 1.6 million currently on treatment, and 1.5 million receive their treatment from support we received from United States government and the Global Fund. 100,000 receive their treatment from the support we get from the federal government of Nigeria. What we're looking forward is to have a situation where we reach a bridge, and that bridge is when we are very confident in our mind that over 95% of people that live with the virus in Nigeria are identified and they're taking medication, and we're closer because we're looking at reaching 1.8, 1.9 million, but reaching that bridge comes with responsibility also. The US PEPFAR program is not going to remain in Nigeria forever. And the Global Fund program also for HIV is not going to remain forever. How do you keep 2 million people on treatment for the rest of their life? Who pays for that treatment? And how do you get that services to continue in the absence of the big donors that support it at the moment is the challenge. And that is what we call sustainability.
Capital flight is also a major challenge as HIV treatment pharmaceuticals are not manufactured in country. Also, a reduction of available human capital are some of the impact of HIV and AIDS to Nigeria's economy.
If I put it simply, conservatively, it costs between 50,000 and 100,000 to maintain a person on drugs a year. It means Nigeria must be pumping in 170 billion thereabouts to maintain those people. We're not talking about building houses or infrastructure or anything, just to keep those people alive. And after spending that 170 billion this year, they must spend it again next year. That's how we continue to maintain them for the rest of their life. As of today, about 86,000 Nigerians get infected annually. Remember I told you there are 1.7 million. That 1.7 million is already costing us 170 billion naira. 86,000 again this year. That is times 100. You add another 8.6 billion to. And Nigeria being a poor country, you know what that means. That money should have been used to take care of that individual, build economic opportunity. So that's why we call it a developmental disease.
Even though over 90% of the population have knowledge of HIV infection and acknowledge the severity of unprotected sex and multiple sexual relationships in the acquisition of HIV, what is the risk perception of HIV infection among Nigerians?
Many people are aware of HIV. I can assure you, when people see you are talking about HIV, oh, I know HIV, I've even seen people who have been affected. That is true. There's about 98% awareness. People know about HIV. People have heard about it. And they've heard about it to the extent that they are tired of hearing about it. But guess what? If you pick an individual and you say, are you at risk of contracting HIV? It's not about wishing away. They will say, oh, God forbid, evil. It's not about God forbid, but what are you doing that predisposes you to it? Do you have multiple sex partners? Whenever you have sexual contact, whether with your regular partner or with a casual partner, do you protect yourself? And do you know how to use that protection adequately and correctly? You see, these are questions that seeks to evaluate individuals' risk. Many of us do not know that we are at risk. And those are the reasons that we keep having at least 86,000 people become newly infected. The recent statistics we have is that the majority of people that are newly infected, apart from the 22% that is transmitted from a mother that is infected to an unborn child, is happening among unmarried people who have not ever been married, either male or female.
We all have a role to play if Nigeria is to attain HIV epidemic control by the year 2030, as it is not a task for the federal government alone.
I'm appealing to all of us. We need to be less judgmental because you do not know the source from which an individual contracted HIV. While we are close to getting to epidemic control, we will continue to have people who will be living with the virus amongst us. They might not be able to transmit the virus because of the efficacy of the drugs that they are using. But we need to stop judging them. They are not guilty of anything that we ourselves are not guilty of. They were living their life normally. They were ignorant of, a lot of them were innocently transfused. So I'd like to appeal to people. We need to have that broad understanding that if we do not stop the stigma, we might not be able to get to the last mile and close the tap finally of HIV spreading in Nigeria.
We've been having HIV around for the last 40 years. It's one of the longest disease that has remained on earth without a permanent solution. HIV doesn't have vaccine. HIV doesn't have cure. The best cure for HIV at the moment is prevention. If you don't have the virus, make sure you protect yourself and you prevent yourself from getting the virus. If you have the virus, then just know that things have changed and HIV no longer kills. HIV no longer makes you look sick, except if you choose to allow HIV to make you sick, to allow HIV to kill you, then that is a choice that somebody has made for himself. But whoever has HIV, go to the nearest facility where HIV services are given. They will measure the amount of HIV in your blood. They will start giving you medication, and they will start monitoring to see how the HIV is disappearing from your blood. So once the HIV disappears in your blood, we'll want to continue to make it at that stage to ensure that it doesn't show in your blood. If it doesn't show in your blood, it's not going to disturb you. It's not going to leave you to affect your loved ones, and certainly it's not going to kill you.
To the general public, the message is simple. Avoid risky behaviors that might contribute to the spread of HIV and AIDS in the country.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
The update segment is next. Keep watching.
The National Agency for the Control of AIDS, NACA, organized a press briefing in its headquarters, Abuja, on the report of a recent mode of transmission study that shows where new infections occur and among which population group. Speaking on the importance of the survey to the national response, the Director General of NACA, Dr. Gambo Aliyu, stated that HIV epidemic control cannot be achieved without ample knowledge of the mode of transmission in the country.
There is no way HIV epidemic can be effectively controlled if we don't identify the taps that are running and are running fast and figure out ways to stop them. The essence of the mode of transmission study is to find out the taps that are running and how fast those taps are running and where. And this is exactly what this study did, to identify those areas or population groups where HIV epidemic transmission is taking place fast than others. And we're glad to say that this study now gives us a new direction in terms of where we are going to focus our attention and where we are going to channel our resources more to make sure in the next coming year or two, HIV transmission is drastically curtailed in the country.
Disclosing the findings of the study, Dr. Aliyu stated that a new group has joined the already known ones that contributes to new HIV transmission.
The big stakeholders when it comes to the taps that are running, the key population groups. We know that HIV transmission happen largely among key affected population. We also know that mother-to-child transmission contributes a greater chunk of new HIV transmission. In fact, countrywide, AIDS represents 22% of all new transmission. And in some states, it goes up to about 50% in terms of representation of new HIV transmission in those states. But in this study, we see a new group. And this new group are the never married adults, the female and male. Never married adult, female and male are now joining the league of running taps that we need to redirect our resources to make sure our efforts both at prevention and treatment, as well as creating awareness, in this group pays by helping us to turn up these taps and turn them fast.
The mode of transmission study was presented by Tosin Adebanjo, the Chief Program Officer, Research, Monitoring and Evaluation, NACA.
Never married uncircumcised and circumcised men around age 18 with an age range between 19 and 31 are responsible for have new infections. Never married with median age 22. And for this, a deep dive still needs to be done to be able to exactly locate what are the traits and other demographics of those particular group. And then we see female sex workers, men who have sex with men, and then the newborns. Across the states, the infections are occurring among never married individuals or negative couples, people who don't have the infections before. And then the third source is the mother-to-child transmission of HIV.
Tosin Adebanjo further broke down the report and explained the policy implications of the findings.
We see that the infection, as against what we had before, there is a decrease among married population, and then there's a flip to never married. And what this tells us is that we need to target places where young people are meeting, schools, workplaces, gathering sports, social media, and the like. We need to expand our pre-exposure prophylaxis, which is medicine that is given to people who are at a higher risk of infections. So that after exposure, they still don't get HIV. And we need to do things in the country to reduce stigma and discrimination, such that key populations, MSM, don't get to endanger themselves by hiding and not accessing the services that they need to prevent acquiring HIV.
One of the mandates of the National Agency for the Control of AIDS is to carry out as well as support HIV and AIDS research in the country.
A major challenge facing HIV control in Nigeria is the growing number of people living with the virus but are yet to learn about their HIV status due to fear of stigma and discrimination. HIV self-test kits is a simple, effective, and quicker way of learning about your HIV status in the privacy of your home. The test can be performed using saliva by rubbing the outer part of your upper gum, followed by the outer part of your lower gum with a flat pad, and then dipping the flat pad into a buffer tube to wait for 20 minutes for the result to read. For more information, contact our call center at 6222 or NACA's website. Our services are available to you Monday to Friday every week.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Well, you've heard it. HIV and AIDS is still very much a threat. So, play your part in supporting the HIV response. Avoid indiscriminate sex. Do not stigmatize or discriminate people living with the virus. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesu. I'll see you. Goodbye.